Thank you very much. My name is Alma Angelica Garcia. I'm professor at the National University of Mexico. I am very happy to be here, and I thank you, all of you. I'm going to present what was my PhD work, assessment of the therapeutic effect of allogenic bone marrow mesenchymal stem cells in the control of pain, inflammation, and lamellar structure in horses with chronic laminitis. Laminitis is a disabling condition that affects laminar corium of horses' hooves. It is an inflammatory disease of horses' hooves characterized by biomechanical compromise, failure in dermis-epidermis junction, disintegration of epithelia, by lysis of the basement membrane, and loss of hemidesmosomes, causing proximodistal rotation of the distal phalanx or sinking of the podophalangeal axis. It can occur in any breed of horses, regardless of sex or technical purpose or age, although it is not common in foals. There are not many studies on the incidence, but some studies mention that it can be between 2 through 34%. Causes of laminitis, also it is not known with certainty how it starts, are associated with diseases of the digestive, respiratory, or reproductive systems that lead to endotoxemia, or orthopedic problems due to greater weight support on a limb, as well as metabolic problems such as Cushing's disease and equine metabolic syndrome. Signs of laminitis are increased digital pulse, increase in hoof temperature, characteristic laminates of different degrees of presentation according to the pain the horse presents, convex hoof sole, rings of the hoof's wall, and severe pain. Diagnosis is based on clinical history and signs. Serial radiographs are performed to assess the degree of distal phalanx, and venograms are also carried out to assess the degree of hoof irrigation. Treatments have been studied for hundreds of years, but there is not 100% effective treatment so far. It focuses on treating the primary disease and endotoxemia. Besides cryotherapy in affected limbs, unimodal and multimodal analgesia, anti-inflammatory vasodilators, support for the distal phalanx by means of insoles, orthopedic shoes, and orthopedic hoof trims are also used to treat laminitis. The degree of oval laminates has been correlated with the degree of histological damage. Histological grade 1 corresponds to oval 1 laminates. Histological grade 2 corresponds to oval 2 and 3, and histological grade 3 corresponds to oval 4. The histological signs of laminitis are immunological infiltration, basement membrane dissolution, loss of epithelia, lamellar atrophy, loss of hemidesmosome proteins, and subsequently the loss of hemidesmosomes themselves. Background. A study prior to us is that of Carter, where they demonstrate decreased expression of p63 transcription factor along the axial abaxial axis of primary epidermal lamella in horses with chronic laminitis. p63 transcription factor is a master regulator of pluripotency, so Carter concludes that the cause of chronic laminitis is the loss of stem cells. Schnabel wrote a paper on the therapeutic use of stem cells in horses with different disease. Regarding laminitis, Schnabel mentioned that the stem cells could be administered by regional intravenous infusion. This method could be useful for medical management of the acute phase. This equipment suggests 2 doses of 30 million every 14 days. Also, they didn't find data on their effectiveness. Trella performed a study comparing intraarterial and intravenous regional perfusion in the administration of stem cells in horses' foot. They labeled the cells with technetium and performed scintigraphy. They observed that intraarterial perfusion presented a better distribution of cells throughout the foot. However, there is a high risk of thrombus formation. Nevertheless, when tourniquet was not applied, there was no thrombus formation, but the cells can migrate far from the foot. In addition, it is technically more difficult to place a catheter in the artery than in the vein. Trella also administered 30 million cells for every foot. Morrison conducted a study on the use of stem cells in cases of laminitis. They applied these cells intravenously and intraarterially and used cells from umbilical cord and bone marrow, administering 30 million each month. Mentioned that all horses improved clinically. However, they didn't carry out further studies. Researchers noted that in chronic laminitis, they wouldn't have a positive effect on the prognosis of these horses, but it was only a supposition since they didn't apply cells in chronic laminitis. Angelone published a work similar to ours. In horses with chronic laminitis, they administered stem cells derived from adipose tissue along with platelet-rich plasma. The first administration consisted of allogenic cells and the subsequent ones of autologous cells. They conclude that the cause of chronic laminitis is the loss of stem cells in the hoof, since all the horses improve by administering stem cells exogenously. No adverse reactions were observed in any horse. In venograms, Angelone observed the formation of new blood vessels in the different arteriovenous plexuses of the hoof. However, their conclusion was that they didn't know what element would work out, stem cells or PRP, since they administered them together. Researchers also indicated that as they administered both allogenic and autologous cells, they were not sure which of the two groups of cells was more efficient. They conclude that the administration of stem cells as well as PRP are a viable, safe, and effective alternative in treatment of chronic laminitis in horses. Marix found stem cell markers in the coronary corium and laminar corium of horses' hooves. They mention that these cells also have a potential role in treatment of laminitis. And this is our research model. During laminitis, physiological stress occurs. There exists release of vasoactive amines, endotoxins, exotoxins, and there may even be mechanical problems of musculoskeletal nature. An inflammatory environment is established into the hoof tissues. Among other hormones, corticotropic hormone and cortisol are released. There are different molecules that are produced or released in the inflammatory process. Different cells are attracted to the inflammacytes, such as macrophages, which are capable of synthesizing metalloproteases, which are enzymes that generate proteolysis, degrading the constituents of the extracellular matrix. In cases of laminitis, metalloprotease in 2 and 9 have been found. This situation causes the destruction of the extracellular matrix lysing the basal membrane. Metalloproteases also disintegrate hemidesmosome proteins. When there is lysis of the basal membrane and loss of hemidesmosomes, the union of the basal epidermal cell is lost to the basal membrane, later to collagen 4 and distal phalanx, presenting epithelial disintegration, so causing that the distal phalanx is detached from the hoof, remaining without support. Due to disintegration of epithelia, there is loss of resident stem cells, whose role within the hoof is to maintain the homeostasis of these tissues, regenerating tissues that are damaged throughout the horse's life, forming new blood vessels to replace the vessels that were injured, maintaining an anti-inflammatory state within the hoof, and avoiding oxidative stress. The consequence of loss of hoof stem cells is the loss of the anti-inflammatory state. Without tissue regeneration, there will be disintegration of epithelial tissues. All these events will lead to greater inflammation and greater presence of macrophages, which increases the amount of metalloproteases. These enzymes bring on a continuous destruction of hemidesmosomes and extracellular matrix, lysing basement membrane. All this will lead to a greater loss of stem cells. This is why we suggest that if the cause of chronic laminitis is the loss of stem cells, it is possible to revert that existing inflammatory state to an anti-inflammatory state by the exogenous administration of stem cells, which will decrease the amount of metalloproteases and consequently will avoid the destruction of extracellular matrix, basement membrane, and hemidesmosomes. Tissues will be regenerated, there will be angiogenesis, and the pain caused by this inflammatory process will be reduced. Bone marrow aspirates were extracted from the sternum of clinically healthy horses, obtaining stem cells by centrifugation gradient method. These cells were cultivated and expanded in laboratory conditions and were immunophenotyped by flow cytometry, being positive for markers CD 105, 73, 90, 28, and 44. Locomotor system examinations were performed in selected horses with chronic laminitis. We used modified Ovel Glasgow Laminess scale and Grimace scale to assess pain. Hoof thermography and venograms were taken to gather evidence of vascular remodeling. Lamellar biopsies were also taken to perform histopathologies, as well as ultrastructural studies by means of using transmission microscopy to have evidence of laminar corium, hemidesmosomes, and basal membrane regeneration. The results that we obtained. Results confirmed significant decrease in values of Ovel Glasgow scale. So we conclude that the pain of these horses were reduced in a significantly manner. Also confirmed decrease in values of Grimace scale. But not significant changes were observed in hoofs temperature. Angiogenesis was verified in all treated horses. Here we see the healthy horse before treatment and after treatment. It was 6 months later, the administration of mesenchymal stem cells. Lamellar corium regeneration was proved in histopathologies. Again, at the left, we see a healthy horse with different tensions. Before treatment, remember that these were chronic laminitis horses, and after treatment, all horses have regeneration of the lamellar corium. Hemidesmosomes and basal membrane regeneration around the new secondary epidermal lamella was proved at ultrastructural level. We suggest that loss of mesenchymal stem cells is a critical event leading to chronic laminitis. Allogenic bone marrow mesenchymal stem cells therapy in horses with chronic laminitis changes the inflammatory environment to an anti-inflammatory environment within the hoof. Regeneration of lamellar corium was proved regardless of the histological state before treatment. Regeneration of hemidesmosomes and basement membrane was also proved. There was no evidence of scar tissue, suggesting that lamellar corium is an ontogenic type of tissue. Allogenic bone marrow mesenchymal stem cells in horses with chronic laminitis promotes angiogenesis of the different hoof plexuses, from proximal to distal, as it occurs in fetal tissues. As a consequence of pain significant reduction, laminesis decreases too, and therefore horses do not remain in the cubitus for longer. These horses are patients who are able to walk normally again. Consequently, skin ulcers formed by prolonged decubitus can heal. Horses increased their food consumption, gain weight, improving the quality of life. Allogenic bone marrow mesenchymal stem cells also improves quality of the hoof wall. In hoof's wall formed over the 6 months of the study, no rings were perceived. The wall thickened and grew more resistant. Due to these results obtained with mesenchymal stem cell therapy in all treated patients that had a poor prognosis before treatment, euthanasia was avoided. It is advised that these studies should be carried out for more than 6 months for future research to evaluate if after a year or more time, there is complete angiogenesis in the entire hoof. It is possible that arteriovenous plexuses of hoofs can contribute to dissipation of temperature as arteriovenous plexuses in other regions of the organism help to decrease temperature. But as far as we know, this hasn't been studied in horses' hooves. In this work, laminar tissue biopsy technique in horses with chronic laminitis was described. This technique was only being described for healthy horses. Measurement of metalloproteases and of inflammatory and anti-inflammatory cytosines must be carried out for future studies. The use of exosomes instead of cells and comparative studies between the use of autologous and allogeneic cells are also suggested. We still have many studies to conduct derived of this. So conclusion, allogenic bone marrow mesenchymal stem cell therapy in horses with chronic laminitis regenerates the situ architecture of laminar corium without scars, promotes angiogenesis, decreases inflammation, reduces pain, and prevents postration of these horses, avoids euthanasia in all horses treated. Improves clinically general condition and life quality of patients. Treated horses do not present local or systemic adverse effects, so infusion of allogenic bone marrow mesenchymal stem cells is safe. Results are improved when combined with orthopedic trimming and orthopedic shoes. Our team suggested that the loss of mesenchymal stem cells is the cause of chronic laminitis. Thank you very much. I accept your questions.
All right. Oh, one question.
Thank you. Great presentation. Did you do any cell tracking? I mean, you have a very central statement there that it's loss of MSCs, but they secrete VEGF and other things that could maybe support blood vessel formation. And I wonder whether that could lead to the results that you're seeing. Have you done any cell tracking to support that MSCs that you supply stays in the tissue and are integrated?
No, we don't do cell tracking. That is another work that we need to do because we need to know where are all these cells.
Have you seen a decrease in native stromal cells? Because you stated that you think that it's the loss of native MSCs. Like, did you look at the density of pericytes, or we don't even sure what MSCs really are in vivo? So I'm just curious about that statement, that that's the reason for, that's the cause of laminitis.
Again, please.
So I think that you stated that the cause of laminitis in horses, that your team thinks that it's because of loss of MSCs. Is that correct?
Yeah.
So I wonder, how did you look at native MSCs, and why do you think that that's the cause of laminitis?
Just because the other words that exist that are saying that this is the cause of laminitis, and because the study of Carter that he concluded that in chronic laminitis horses, P63 is reduced, and that is why they are having laminitis.
All right, so not based on your data, it's literature.
No.
All right, thank you.
Thank you.